Okay, it's December, and if you are a nursing student, you either have already graduated in December or you are coming up on your last semester, if you're a senior, of course. So, here is a question I feel like it's really bad advice. Ugh, that's all I can say. So, I went into nursing school and I kind of always knew what I wanted to do. I knew where my heart was. I knew I did not like adult nursing. I knew I did not want to be in the ICU. Even in clinical, like I enjoyed it. It was fine, but it was never something that I was drawn to. NICU was it was like, I can't even explain it. I still, as a nursing student, remember the day I set foot in a NICU for the first time. And I remember walking out of there like, there's no doubt of what I want to do. I loved every second of it. The really critical babies up into the feeder and grower babies. I knew that's what I wanted to do. I also love, well, baby nursery too. And so I was fine if I got, that job as well. I knew the NICU 10 years ago was a really hard position to get as a new grad, and it was. But I did it, and I was really proud of myself for that because I worked really, really hard. School's never come easy for me, so it was rough. I know you all are thinking that too. If you've been through nursing school or are going through nursing school, you can attest to that. So here is the bad advice I personally think nursing students are given all the time, is that you need to work med surg before you work what you want to work. I knew I never wanted to work with an adult patient. That was not where my heart was. That's not my passion. I didn't enjoy researching those topics. I love babies. I love the NICU. I love lactation. I love well baby nursery. So to me, for me to go work in a med surg floor was kind of a waste of time, especially since the NICU is a whole different kind of learning. It's a whole different kind of nursing I feel like isn't focused on a lot in nursing school. So a lot of what I had learned in nursing school, I needed to relearn in the NICU. So the med surg floor wouldn't have done me any good. Now, if I was gonna go to an ICU or something more geared to more adults, I could see maybe a med surg floor being a better choice for me, but that was just never anything I wanted to do. So if you are a nurse and you are given that advice and you either took it or you didn't take it, let me know what you think. Do you think that you need to work on a med surg floor before you go into specialized care? I will say this is maybe kind of how I understand it. So obviously there's so many different kinds of NICUs. The first one I worked in was huge. It was a level 3. We had respiratory therapists, vents, night, all the things. 24 weekers at that time were the youngest we took. Now I work in a much smaller NICU. We have 8 beds. We are currently growing. I don't see as much of those things. If we get a 24-weeker, we would ship them to a bigger hospital. The youngest we keep currently is 30 weeks. So my skills are definitely not what they used to be when I worked in those bigger NICUs. So if I was going to work in a NICU for the very first time, I would always suggest going to that bigger NICU. You are gonna get the best experience, and it just helped me see the broader picture of why some things are bigger issues that I wouldn't have seen with a bigger term baby. So I do understand that. So maybe it's the same kind of thing with med surg and ICU or surgery or something like that. I don't want to give that advice to new grads. If you have a passion and you know that's where your heart is, girl, you go for it, or boy, go for it. If you don't get that job the first time, keep trying, and it's worth the work, I promise. If you love nursing the way I did and still do, the work you are going through right now is worth it, I promise. So let me know what you think. Let me know if anyone gave you this advice, and did you take it or did you not take it? I want to know.